A law designed to help more people access eating disorder treatment may be doing the opposite.
Yeah, last year, a state law took effect preventing someone's BMI from determining their level of care or treatment. 9 News reporter Rachel Krause joining us now. Rachel, doctors say that's making it even harder for people to get the treatment they need.
Yeah, eating disorder experts say the law was written with the best of intentions, but because you can't use someone's body size to be considered with treatment, it's allowing insurance companies to stop covering some treatments once a patient is on the path to getting better. And doctors say that's exactly when patients need the care the most.
It has been really frustrating.
Dr. Elizabeth Wassenaar is the regional medical director for Eating Recovery Center. She says people of every age, gender, and shape deal with eating disorders, and that care should be accessible to them all.
On face value, I 100% agree with this legislation.
Before this new law, it was hard for larger people to find care and get insurance to cover it.
It was. Over time, we have absolutely seen that patients who live in larger bodies who have eating disorders have been excluded from levels of care because of their insurance policies.
Lawmakers passed legislation designed to correct that challenge. Instead, it's creating a new barrier to care.
Patients who are in small bodies, who are malnourished, are actually being excluded from care or being asked to step down before they are ready. And insurance will say, well, it looks like they're healthy enough to do this at a lower level of care. And so we used to be able to say, yes, but they're still very underweight. And so when I've said that recently to insurance companies, yes, but they're still very underweight, they'll say, oh, I can't consider that as a part of their medical necessity for care.
And she doesn't believe insurance companies are to blame.
We don't believe that insurance companies are intentionally trying to hurt their customers, but we know that they are also bound by this statute. And the reality is when you have a statute that makes this sort of determination, then it takes the decision out of the hands of the medical providers who are taking care of people with these patients.
Dr. Wassenaar hopes to see the law change again. She says this is more than just frustrating. It puts patients' health at risk.
These patients are at very high risk of relapse into their disease and at very high risk of medical complications of malnutrition. So it is very serious and severe to release people from treatment before they are ready to step down.
Dr. Wassenaar says they're working with the Behavioral Health Association and advocates to find a path forward for this law that can be inclusive to everyone in need of treatment. She says all they want here is to make sure that it's not insurers or lawmakers, but the medical providers determining care. Rachel Krause, 9 News.